about the 9th version of the containment measures against the COVID-19. And we have continued with the policy of the fight against rebound of domestic cases and imported cases. And we will continue with our strategy of the dynamic zeroing. We have also made detailed plans about the definition of the median and high-risk regions, as well as the treatment and diagnosis of the patients. And according to the latest version of this document, we have to make our containment measures more targeted. It doesn't mean that we will lower our guard. And we have also organized a video conference urging all localities to put on their guard against the COVID-19 virus and also apply all the instructions according to the 9th version. And for the unnecessary measures, we have to abolish all of them. For the underlined policies and also measures at the local levels, we have to make some corrections. We will also send the teams to guide the work at local levels. For some topics that have attracted a lot of attention from the public, for example, issues regarding the 9 disallows, we have already made it available online with a complaint zone. And for the different localities, they have also made it possible for people to express their opinions. For all those wrongdoings related to the 9 disallows, we will make the disclosure and also punish the wrongdoers. The topic of today is the targeted COVID-19 containment measures. We have invited Deputy DG and Level 1 Counselor of the Disease Prevention and Control Bureau of the NHC, Mr. Lei Zhenglong, Deputy DG of the NHC Inspection Administration, Chen Youquan, researcher of the Infectious Disease Prevention Division of China CDC, Madam Wang Liping, and researcher of the Institute of Viral Disease Control and Prevention of China CDC, Wang Wenling. And now the floor is open for your questions. If you have a question, please raise your hand and then identify yourself. So the first question, please. With CMG CCTV. We have noticed that today we have made it public, the 9th version of the work plan against the COVID-19. What is the consideration behind that? And what is the proof to support the publication of the new version? To Mr. Lei Zhenglong, thank you very much for your question. For the containment plan, we have made the modifications due to the 3 considerations. First of all, we have noticed there are new changes in the picture of the fight against the COVID-19. COVID-19 is still raging across the world. Since this year, domestic cases in China have become more frequent. And COVID-19 outbreaks have covered a lot more regions, especially in the Yangtze River Delta, Pearl River Delta, Beijing, Tianjin, Hebei area. A lot of regions have been put under threat. We are facing a mounting pressure in our fight against rebound of domestic cases and imported cases. This year, we have gradually stabilized our fight against the COVID-19. We have noticed a reduction of the positive nucleic acid test results, and these are the enabling conditions for us to modify the version of our containment plans. Second consideration, we have noticed the characteristics of the variants. Omicron variant is the prevalent strain of virus with imported cases and also the rebound domestic cases. This is faster distributed, and it's also a more latent one. This has posed more challenges to our containment work. Preliminarily, we have already started some pilot researches according to the decisions of the CPC Central Committee and the State Council. In April and in May, in Suzhou, Dalian, Ningbo, Qinghai, Guangzhou, and Chengdu, in total 7 cities of China, we have carried out 1 month of pilot work with the improvement of the COVID-19 containment measures, we have accumulated so many data in Shanghai, in Jilin. We have also accumulated a lot of good practices, and also we have learned a lot of lessons from the practices. That is how we can enable this round of modification of the containment plans. Next question, please. Thank you. With the Health Journal, compared to the previous version, the current 9th version, what is the novelty about this version? Again, to Mr. Lei Zhenglong, compared to the 8th version, in the version number 9, we have made 3 aspects of changes. First of all, for the quarantine duration and quarantine method of people in risk. For example, the duration of the quarantine of close contacts. In the past, it was 14 days of concentrated quarantine plus 7 days of quarantine at home. We changed that to 14 days concentrated plus 3 days of quarantine at home. That is a major change. The second major change is that we have integrated and aligned the standards of the setting up of medium risk region and high risk regions. Previously, we have 2 systems, one for the low, medium, and high risk regions, and another for the controlled area, regulated area, and also the lockdown areas. In the 9th version, we have aligned the 2 systems of regulation standards. So we will, since now, use only the low, medium, and high-risk regions. And this is the future standard for the zoning. And third, we have also renewed the instructions for the monitoring and also the supervision. At grassroots levels, we will add up the utilization of antigen tests. In different scenarios, we have also clarified the regional test versions. For the big cities and also the capital cities of different provinces, we have made it clear that what are the conditions for the carrying out of a regional nucleic acid test. For the 9th version of containment measures, we have improved our methods targeting COVID-19. It doesn't mean that we have lowered our standards. Actually, we are making our measures better targeted against the COVID-19. We would like to seize the most essential tasks, and also we have to abolish all the unnecessary measures. We have to follow that strategy of dynamic zeroing and also stay alert against the rebound of domestic cases and imported cases. We have a concentrated utilization of the resources, and we have to form a synergy against the virus. Next question, please. Thank you. And with People's Daily, in the 9th version of containment plan, there are improvements about the quarantine methods of people in risk. What is the consideration behind that? And according to that changes, does it mean that we have loosened up the control of these people? To Madam Wang Liping. Thank you. In order to make our containment measures more targeted and more precise, in April and in May, we have decided to carry out the pilot work of improvement measures in several cities. The latent duration of Omicron variant is 2 to 4 days, and the majority of the detected persons have been discovered within a week. According to the accumulated experience of many cities, and based on the facts that we have already supervised and noticed, we have decided to modify the duration of quarantine for the people in risk. In the past, it was 14 plus 7, and now it's 7 plus 7. And for the nucleic acid test, today we will make the new changes about the nucleic acid test method. In the past, it was the 1st, the 4th, the 7th, and also the 14th day of their concentrated quarantine. And now we change that to the 1st, 2nd, 3rd, and 5th day of the concentrated quarantine, and also on the 3rd day of their home-based quarantine. For the close contacts of the close contacts, in the past, it was 7 days of concentrated quarantine, and it has been changed to 7 days of home-based quarantine. And they will also take the nucleic acid test at home or abroad. We have noticed that the Omicron variant has become the most prevalent one. For the control and also the regulation of the close contacts and also the close contacts, the close contacts of the close contacts, we have made some changes to their quarantine method and duration. It doesn't mean that we have lowered down our guard. Instead, we have already studied the possibility of the spreading of the risks. It's also a proof to show you that we have made our containment measures against the COVID-19 more targeted. Next question, please. Thank you. And with the Phoenix Media Group. Because the Omicron variant could be spread more fast and also it's more latent, what are the new measures against the COVID-19 virus according to the latest version of the containment work plan? Again, to Madam Wang Liping, please. Thank you. Because Omicron variants could be distributed in a faster manner and in a more latent way, we have put a greater focus on the monitoring. We have combined the monitoring plus the nucleic acid test. We have also strengthened the synergy between the monitoring in different channels. For example, the monitoring on the persons and also the monitoring of the environment. According to the 9th version of the work plan, based on the existing rules of the 8th version, we have added up something more. For example, we have made the nucleic acid test on the high-risk personnel more frequent for people who have the direct contact with the cross-border goods or passengers, like people cleaning the environment at airports and at the ports, people working at the customs, those frontline workers who have the direct contact with the imported goods and passengers, or people working at the designated hospitals who have a direct contact with the fever patients or people with the COVID-19 risks. Those people are deemed as the high-risk population. Every day they have to receive the nucleic acid test once. And for the environment, that is quite populated and also with a high density of the people. For example, the delivery people for the goods and also for the takeaway meals, construction workers, transportation-related workers, and people working in the grocery markets and also supermarkets, as well as the other medics working outside the fever clinics in the hospitals. Every week they have to take nucleic acid test twice. If there is the outbreak locally, then according to the real demands, we have to update their nucleic acid test frequency. So those are the new requirements for the nucleic acid test. And for the monitoring, we have also strengthened our monitoring on the drugs. Usually, locally, once there's the outbreak of the COVID-19, for the offline and online pharmacies, if there are some purchases of the fever-related drugs or the cold-related drugs, we have to get the purchasing parties registered, and we will also keep a close eye on these people buying these medicines. And we have made the third improvements, that is the adding up of the antigen test, especially at the grassroots clinics and community hospitals for people who have already demonstrated some symptoms like the fever or other possible symptoms, or people living in a high or medium risk regions. We could add up another layer of the antigen test because the antigen test could give us the results much quicker than nucleic acid test. And by doing that, we can consolidate and strengthen our system of monitoring, make it more sensitive to show us the early signs of a possible outbreak. Thank you. Next question, please. Thank you. With the Fengmian News, we have noticed that today on the website of NHC, there is the zone for the comments, collecting opinions from the public about the 9 disallows. And if people run into some problems, could they find other channels to make the complaints or to express their concerns? To Mr. Cheng Youquan, after the publication of the 9 disallows, the team of the State Council has worked with the other units of work to set up a specialized leading team with the representatives from the Ministry of Education, from MARA, from MOFCOM, and also from the Ministry of Culture and Tourism, as well as from the General Customs, as well as the others. And in certain cases, we could also consider the possibility of the integration of other representatives of many more departments and ministries. By using this mechanism of work, we are fighting against the one-size-fits-all measures and also the overly restrictive and unreasonable COVID-19 containment measures. Just now you have mentioned if we can find any other channels for the collection of the opinions. Today, with the public website of our National Health Commission, we have made it possible for people to express their opinions and also make the complaints. We also have a hotline available. People, if they have problems, they can make a phone call or they can leave the message on our website. And once received, those messages will be treated seriously by our side. And we will also resolve the headaches and problems for the people in a very efficient way. We also urge the joint prevention and control mechanism at provincial level to follow the example of our national joint prevention and control mechanism, and also to fight against the overly restrictive and unreasonable COVID-19 containment measures. So we have the 2 layers at central and provincial levels. We have to gradually consolidate the application of the measures and to fight against the one-size-fits-all measures. At the same time, we also urge the provincial joint prevention and control mechanism to make it possible for the local people to make the complaints or to express their opinions or make suggestions concerning the overly restrictive and unreasonable measures. Once it's confirmed, then we have to correct all the wrongdoings. Next question, please. Thank you. With the daily economic news, we've noticed that in the 9th version of the containment, we have modified the standards of the definition of different risk areas and what will be the measures concerning different zones of risks. To Mr. Lei Zhenlong, in the 9th version of work plan, for the low, medium, and high-risk zones, we have renewed the standards of the zoning. For the high-risk zones, it means that there is the frequent activity of the asymptomatic cases or confirmed cases, or it's the residence spots of the confirmed or asymptomatic cases. It will be zoned according to the level of the villages or streets. in the high-risk regions, people should not leave their households, and we will deliver the services to their doorsteps. For 7 days in a row, if there's no newly added cases, then the high-risk areas could be lowered to the medium risk areas. And if for 3 more days there's no newly added cases, they can be lowered to the low-risk areas. If there's the spillover effect, you can take the measures of the 7 days of concentrated quarantine, and on the day 1, 2, 3, 5, and 7, you have to follow the nucleic acid test. For the workplaces and places of activities that have a risk of possible spreading of the virus, they can also be incorporated into the high-risk areas according to the demands. In the medium-risk areas, people should not step out of the zone, and people have to pick up their groceries and other goods in a staggered manner. In 7 days in a row, if there's no newly added confirmed cases, they can be renamed as the low-risk areas. During the home-based quarantine, in day 1, day 4, and day 7, 1 round of nucleic acid test. If there's no enabling condition for the home-based quarantine, then we have to put the people in question into the concentrated quarantine. For the counties or the cities, districts that have the medium or high-risk areas, the other areas without the risk factors, they are low-risk areas. In the low-risk areas, for people leaving their city or their district, they have to carry with them the negative nucleic acid tests within 48 hours. For people traveling across the zones, if they come from a low-risk area, they don't have to be put under quarantine at a destination, but within 3 days, they have to accomplish 2 rounds of nucleic acid test. They also have to take measures to protect themselves. After the outbreak at county, district, prefecture levels, there are the low risk, medium risk, and high risk regions. And after the clearance of all the cases, all those high risk and medium risk regions will be downgraded to the low risk areas. If there is the low risk of spreading of the virus, and we have already put all the people in question in quarantine, if we consider there is no further risk of the spreading of the virus at community level, then we will also make this zone the low-risk area. This is how we make our containment measures more targeted. Next question, please. Thank you. With CMG Financial News Center. Recently, what is the current status of the spreading of the virus in our country? And what are the containment measures? Again, to Mr. Lei Zhenglong, please. Thank you. Recently, domestic cases have delivered the following features. First of all, we have yielded a lot of achievements. In general, there is the low-level fluctuations of the cases. Since the 18th of June, the daily newly confirmed cases is lower than 50. During the 20th to 27th of June, we have in total reported 198 confirmed cases. That is 25 cases on a daily basis in average. And second feature is that there is from time to time sporadic outbreak of COVID-19 at local level. And before the quarantine of the people in question, usually they have a lot of activities spread in different areas. So that has made our control more difficult. And third, Omicron variant is still the prevalent. We have to give more attention to the imported Omicron strain BA.4 and BA.5, there is an increasing tendency of the cases caused by the Omicron BA.4 and BA.5, so we have to pay more attention to them. The prevalence of Omicron variant has still a lot of uncertainties. We're still facing a huge task. We have to make this work long-term and persistent. Based on the new features of the virus, we have to dynamically improve our version of containment, make our measures more targeted, and stick to the baseline of no rebound of domestic cases. And we have to continue to coordinate our efforts of COVID-19 containment and socio-economic development. Next question, please. Thank you. Recently, in some countries, we have noticed the prevalence of Omicron BA.4 and BA.5. What is the impact on our country? To Madam Wang Wenling, please. Thank you very much for your question. It's a great pleasure that you have paid attention to the variant strains. Actually, after the appearance of COVID-19, the coronavirus, there's the non-stop variation of the strains. For example, the VOC proposed by the WHO, there are alpha, beta, and delta, and gradually those variants have disappeared from the stage. Starting by last December, Omicron has taken the lead. From last December to this March of this year, the majority of the cases are caused by the Omicron variant. There's one important feature of Omicron variant. The variant itself is changing. There are also some sub-strains appearing on the stage. According to WHO, there's the list. Inside, there are 6 strains. For example, the BA.4, BA.5, and also the 4 substrains of BA.2. For example, BA.2.9, BA.2.11. For all those 4 substrains, we don't know what would be the future picture, but we have to keep a close eye on that. We also have a computing database. According to the result of this database, with the substrains of the Omicron, the top 3 are BA.5, .2, and .4. According to the prevalence data in the world, BA.5 and BA.4 have received a lot of attention in Israel, UK, and South Africa. They are the prevalent. And in Netherlands and France, we have also studied the strains that have infected the patients. BA.4 and BA.5 have caused a lot more patients. According to the predictions of the experts, this summer, BA.4 and BA.5 may cause new waves of infections. This international raging of the virus will, of course, have some impact on our country. Since this February 2022, the major substrain of Omicron has become BA.2. And considering the current status in our country, starting by May, for the imported cases, we have already detected BA.4 and BA.5. And just now we heard that in Macau SAR, the current outbreak has been caused by BA.5. So, judging by the prevalent situation of the virus in the whole world, we have to pay more attention to the BA.4 and BA.5. And based on the current results of the researchers, the immune fleeting capacity and spreading capacity of the BA.4 and BA.5 have been upgraded. This would make our containment task even bigger, and we are also facing huger tasks in fighting against the rebound of domestic cases and also the imported cases. People in our country have attached great importance to the future development tendency of the BA.4 and BA.5. We have to keep a dynamic monitoring on the global picture of the spreading of the virus. And at local level, we have to apply the requirements of the 9th version of containment measures and to continue with our fight against the virus. Thank you very much. Next question, please. Thank you. With the Xinhua News Agency, just now, as is mentioned, there is the comment zone on the website for people to express themselves. So we are wondering whether all the complaints can be settled or the questions can be answered, and how you can proceed with the settlement of the opinions and also the correction of the wrongdoings. To Mr. Cheng Youquan, please. Thank you very much for your question. Just now, we have mentioned that at provincial level, we also have the Provincial Joint Prevention and Control Mechanism. They will follow the example of the National Joint Prevention and Control Mechanism of the State Council. At provincial level, they will first of all appoint a person in charge, and this would be the head of the leading group, and they will also establish their own leading group of members. For this joint prevention and control mechanism, they will form a synergy to solve the problems and headaches for the people. According to the complaints made by people and also the opinions expressed by the people, we will do the tracking and also the settling of the problems. We at national level have also been working closely with the provincial levels of joint prevention and control mechanism. We also urge the local departments to seize more clues and also keep a close eye on the settlement of the questions. For lower levels of the governance at city level, county level, etc., we also urge the local government to fight against the one-size-fits-all measures in place. We have to verify all the proofs and clues, and first of all, start with the pilot work and ask the other parties to follow the example. We have to make sure that all the complaints are very well settled and treated. If necessary, the comprehensive team of the China's Joint Prevention and Control Mechanism of the State Council will also be joining this effort, and we would be investigating some cases. If there is the evidence showing that there is the violation of the requirements of 9 disallows, then we will make the disclosure and also to criticize all those wrongdoings. Recently, we have discovered that some places, they have arbitrarily applied the quarantine and restrictive measures for people coming from Shanghai municipality. We urge them to immediately stop that wrongdoing. The last 2 questions for today. Thank you. With the South China City Journal, what is the current status of the vaccination, especially for the vaccination progress with the people above 60 years old? What is the future goals? To Mr. Lei Zhenglong, please. Thank you very much for your question. According to the Joint Prevention and Control Mechanism of the State Council, we are continuously guiding the vaccination at local level. As of 27th of June, in total, we have vaccinated 3.4 billion times, with 1.29 billion people vaccinated. Totally vaccinated people, 1.26 billion. representing respectively 91.79 and 89.41% of the national population. You have also mentioned people above 60 years old. We have covered more than 200 million of them. 203 million people fully vaccinated. Covered and fully vaccinated people represents 88% and 83% of the elderly population. Moving forward, we will continue to give instructions to local government to continue with the vaccination and also to vaccinate more elderly people. Last question for today. Thank you. With the Oriental media, we have noticed that there is a lot of content with the 9th version of the work plan and containment measures. What is your plan to make all the people understand the content in the 9th version? Again, to Mr. Lei Zhenglong to answer to the last question for today. Thank you very much. Currently, the full text of the 9th version of the containment work plan is available on the website of the NHC. And this morning, the leading group has also organized a video conference with the local government representatives. We urge them to diligently follow the guidance of the 9th version of the work plan. We have also explained the content of the 9th version to all of the representatives. In the coming days, we also expect to organize the meetings and the seminars of trainings for the medics and also leading personnel at local levels. We will also give guidelines and instructions to the local governments to renew their own provincial and local versions of the containment measures. If there is a mismatch, then immediately we urge them to align their local version of containment measures with the national work plan. From time to time, on a regular basis, we will also do the monitoring and also the investigation to make sure that this 9th version will cover every corner of the country. Thank you very much. Today, all the experts have talked about the targeted COVID-19 containment measures. They have briefed the 9th version of the prevention and control against COVID-19, and they have also made detailed explanations about the 9 disallows. Please continue to join our press conference. That is all for today.